You know, there may come a time when you or the kids or someone might, get a cold or a touch of the flu or maybe bumps and bruises, and you really don't need to go to the emergency room. You can't get a hold of your general practitioner. You don't have one, so what do? Well, what you do is you go to Maxem Health Urgent Care. There are several here along the Mississippi Gulf Coast, and we have Holly Harlan, who is the Vice President of Operations, and Kim Bowen, who is one of the nurse practitioners with Maxem Health. Thanks for being on the show with us today.
Thanks for having us.
Well, very good. Let's talk a little bit about Maxem Health Urgent Care and exactly what it is.
Sure. So urgent care has really come up quickly in the past few years. It's been around for a while, but a lot of people still don't know what exactly urgent care is, what we can do for them here. So we like to educate our community that we're here to offer quick, affordable health care when they need it. So, there's primary care, there's emergency room, and there's urgent care. So we fall somewhere in between. If you can't get in to see your primary care or you don't have one, or if you have something going on that you think you need to be in the emergency room for, but you really don't, urgent care is here for you.
And that's one of the great things about the urgent care is because it might be something minor, or if kids got a cold or whatever, or you got a touch of the flu. Here it's flu season. It seems like every time, all the time of the year because of the crazy weather that we have. But it doesn't necessarily. Now, if you break something, you need to go to emergency room, something like that. What about you have a medical discount program? Can you tell us about that?
Yeah, so we've kind of rolled this out in the past year. We're really excited about it. It's a great program for the community for patients that don't have access to insurance. What we do is offer our medical discount program. It's essentially like a gym membership almost. You pay $35 a month, and then anytime you come into the clinic, it's just a $35 copay, and that's going to cover all the services that we offer, excluding physicals or flu shots or something that's not medically necessary, but everything else it covers, and it's been really, really successful.
Okay, I was sitting here thinking about this. You're saying the membership is $35 a month.
It is.
And whenever you come in, it's $35 copay.
Yes.
And then I'm thinking about what I pay for my health insurance every month.
You're thinking about dropping your health insurance, right?
This is another show here we need to talk about.
Really?
It really is.
Yeah.
Kim, tell us, as a nurse practitioner, that's mainly what you have there at the clinics are nurse practitioners. And I mean, my general practitioner or whatever right now is a nurse practitioner. So, I mean, y'all know your stuff.
Well, the healthcare is shifting to nurse practitioners for primary care. So that's what you're going to see. Most of the community in the future will see a nurse practitioner versus seeing an MD, unless they're sending them for something specialty.
Right.
That's just the change of healthcare right now. Back to the healthcare discount program, I'm super passionate about it as well. I feel like this program is an awesome gift to the community from Maxem Health. I haven't seen another program like it where we're actually doing something to meet the healthcare needs of America. So many Americans don't have healthcare insurance. So
you're right, because they can't afford it.
They can't afford it,
Exactly.
and this is extremely affordable. It is a $35 subscription a month, and then $35 visit. When our visits can range anywhere from $130 to $150
right.
at a visit. That's $35. That is totally meeting the needs of the
My
uninsured.
copay is $40 whenever I go, for a checkup or whatever, things like that. So do y'all do things like that? Just yearly checkups, physicals? I know you have a great program for kids getting ready to go back to school. It's like a $20 checkout before they go back to school.
Yeah, so it's really important for us to meet the needs of the community, to be accessible to the community, and to offer services at an affordable rate. So we do $20 school physicals for the kids going back to school. We do $15 flu shots, which is one of the most affordable we've seen. Well,
you've got a great Healthy Kids program. I was reading about it on your website.
Yeah.
And it's a great program for healthy kids, and kind of giving them a guideline, because Mississippi is known for #1 being in obesity and type 2 diabetes, and a lot of it starts with the kids because they're not nutritionally taught the right way on how to keep themselves healthy, and going to school and everything. This kind of gets them on the right track.
Yeah, so again, it's really important to educate communities because especially if they don't have access to things like that. We take a lot of pride on providing that education.
Talk about some of the things that you would go to ER for and over urgent care.
So a couple of things that we recommend patients go straight to ER for would be chest pain, severe abdominal pain, broken bones where you can actually see the bone, or lacerations where you have bleeding that can't be controlled, which indicates it could be an artery or vein that's been nicked. Those are a few things that chest pains, symptoms of stroke, paralysis, numbness, tingling. Those are things that you definitely need to just pass urgent care and go straight to ER for.
Okay, all right. And we talked about flu season and the shots and everything. Talk about why you should get a flu shot and some of the common myths.
Well,
I mean, I know a lot of people are saying, I don't want it, I don't like it, or, I don't get it.
We've had over tens of thousands of deaths last year associated with the flu. That's one reason to become vaccinated. The flu shot can't prevent the actual flu, just being immunized with a flu vaccine. Reasons why one wouldn't, myths, is that they think that they might actually get the flu from the flu vaccine, which is a myth. You do get an attenuated version of the flu to help you build your immunity, but you don't contract the flu. It's just that your immune system is busy fighting your vaccine to build the immunity that you just need to make sure that you're not around sick people. Or not be sick when you actually get your flu shot.
Y'all do a lot of stuff with the community, a lot of programs.
Yes.
And again, you can go online and find a lot of these programs all over the South, Mississippi and everything, which people can be aware of. Matter of fact, all the different clinics that you have: Gulfport, Ocean Springs, Pascagoula, Picayune, Hattiesburg, Petal, Flowood, Soon, and McGee, and you even have them in Louisiana: Slidell, Mandeville, and Hammond. So there's a lot of offices that people can choose from. And again, you can go on your Facebook page or your website and find out exactly where they are. Less than a minute left. Anything else that you want to add?
Just if you want to find a location near you, you can visit our website. We're growing every year, and we're just here if you have any questions for us. If you
well,
need
you have
anything.
certainly enlightened me on some things there. I appreciate y'all very much for coming out. Holly, Kim, thank you so much for coming out and sharing all this information with us. Again, if you'd like some more information about Maxem Health Urgent Care, the number's on your screen. You go to their website and check out all the cool stuff there, all the different programs that they have, and especially that great $35 a month thing. Maxem Health Urgent Care.